Hey, how are you doing today, Miss Hott?
I'm good.
All right, great. Today we're going to be performing a head-to-toe physical assessment. That's going to consist of me listening to lung sounds, heart sounds, and abdominal sounds.
Okay.
All right. I want to get you to confirm your name and your date of birth.
Jada Hyatt, 7/21/99.
All right, great. You know where you're located today?
Meridian Community Hospital.
And do you know today's date?
April 1st.
All right, great. On a scale of 0 to 10, with 0 being no pain and 10 being the worst possible pain, what would you rate your pain today?
0.
All right, great. I'm going to go ahead and wash my hands and put on my gloves so we can go ahead and do the physical assessment. All right, got my gloves on. All right, so we're going to go ahead and go on with the physical assessment. All right, we're going to check your pupils. We're going to make sure that the lights are dim, and if I could get you to stare at a place on the wall.
Okay.
All right, the pupils are equal, round, and reactive to light. We're going to go ahead and check the mucous membranes now. All right. All right, mucous membranes are pink and moist, the way that they should be. All right, so now we're going to check the skin turgor. We're going to check on the sternum. And typically I would do this like seeing the skin. All right, so the skin turgor is prompt. That means the patient is hydrated. So now we're going to go ahead and listen to heart sounds and lung sounds. All right, so I'm going to do this over the shirt. Normally I would do it with the shirt, with the skin exposed. Aortic, pulmonic, tricuspid, and mitral. We're going to listen to the mitral for 1 full minute. S1 and S2 heart sounds present and regular. All right, so now we're going to go ahead and listen to lung sounds. Making sure that we listen through the intercostal space because we can't hear over bone. All right, and now we're going to listen to bilateral lung sounds. All right, now we're going to go over into the other side, listen to the bilateral lung sounds. All right, now we're going to listen to posterior lung sounds. And again, we would make sure that the skin is exposed. All right, lung sounds are clear bilaterally. All right, so now we're going to go ahead and assess the upper extremities. So we're making sure that there's no type of edema or redness in the upper extremities, no lesions or abnormalities. Everything looks good. We're going to assess the temperature of the skin with the back of our hands. All right, the skin is warm and dry. We're going to check the nail beds. Nail beds are clear and convex. We're going to check capillary refill on both ends. All right, capillary refill less than 3. We're going to assess the strength in the upper extremities. Get you to push back for me. Get you to pull towards yourself. All right, and get you to squeeze my fingers. All right, the strength in the upper extremities are good. We're going to check the radial pulse. All right, radial pulse is strong, equal bilaterally. All right, so now we're going to assess the abdomen. All right, first we're going to inspect the abdomen, making sure that there's no swelling, lesions, or any type of masses. All right, so everything looks normal there. So we're going to go ahead and auscultate lung sounds or abdomen sounds. Typically, we're going to listen until we hear 5 bowel sounds in each quadrant. All right, bowel sounds are normal active. If I could ask you, when's the last time you had your last bowel movement and voided?
Last night. And voided this morning.
Okay, all right. So now we're going to palpate the abdomen, checking for any type of masses or abnormalities. Checking in each quadrant. All right, everything looks good there. So now we're going to work our way down to the lower extremities. We're going to assess the legs for redness or edema. Do you have any type of pain or anything in your lower extremities?
No.
Okay, patient doesn't have any type of pain in the lower extremities. All right, so we're going to check the back of the calves, making sure that there's no edema, no redness, no signs of blood clotting. We're going to check for warmth in the calves. All right, the calves are warm and dry. All right, so we're going to assess the feet now. We're looking at the nail beds. The nail beds are clear and convex. We're going to check for capillary refill in each one. All right, capillary refill is less than 3. We're going to assess the strength in the lower extremities. Get you to push back for me. All right, get you to pull towards yourself. All right, get you to lift up. All right, the strength in the lower extremities are good. All right, so we're going to check the posterior tibialis. All right, equal, strong bilaterally. We're going to check the dorsal pedis. All right, it's equal.